All right, everyone good? Okay, so first of all, I would just like to thank each and every one of you for being here. As we near International Overdose Awareness Day, which is on August 31st, which our partner, Mary Labine, will further explain in a couple of minutes. It was important to local youth that they learned alongside you, our community members, about the impacts, stigmas, and signs of addictions and overdose. As a result of that, a partnership developed between AMHS and United Way HPE's Youth2Youth program. My name is Caitlin Lalonde, and I am a Community Impact Coordinator and the coordinator of the Youth2Youth program at United Way, Hastings and Prince Edward. We thank you all for attending and watching this evening. I'm going to first explain the format for tonight. So we plan for this panel discussion to last 1 hour long. Youth have prepared questions for our panelists based around the local perspective of addictions, overdose in our community and how we're experiencing it. We have myself, Amanda, Jessica Coolin, and Ali from the Quinte West Youth Center asking questions tonight. The session is being recorded and will be shared with anyone who registered on Eventbrite. Again, this session is webinar format, so microphones and cameras will be turned off for attendees. The Q&A is kept on, and if there's time at the end, we'll ask questions from the audience. I would like to introduce Mary Labine, Director of Addiction Services at Addictions Mental Health Services, Hastings and Prince Edward, who will briefly talk about IOAD and the importance of this conversation.
Thanks, Caitlin. Hi, everybody. It's truly my honor to be here today, and I see this as huge progress. My background is I've worked for over 30 years in the addiction sector. And so any kind of awareness around that just makes me very happy. As Jason and Amanda would know, who are on this call, it's kind of what I live and breathe on a daily basis. This particular International Overdose Awareness Day was first initiated in 2001 in Australia. And it's recognized globally, always on August 31st. And it's become the world's largest annual campaign to end overdose and reduce stigma, specifically around overdose deaths that people have experienced. And what I can say is that growth has continued to grow. So in HPE, the very first International Overdose Awareness event occurred the year prior to COVID, so 2019. We had hosted an event at Market Square in Belleville, and in 2020, during the first year of COVID, nothing really occurred at all in any of the communities at any kind of capacity, I suppose, other than smaller groups maybe. And last year, Addictions Mental Health Services, in partnership with other agencies, did host a virtual event. So this year, it's quite amazing in terms of all of the events that have been happening. We'll be hosting another live event August 31st, which there'll also be an event in Bancroft. Quinte West is doing a memorial walk. Public Health, I know, is doing an naloxone training in Prince Edward County. And this initiative is really new, and I'm just really thankful that you guys organized this, so thank you. And so why is it important? And many people will say that it's more important now than it ever has been. And the reason for that is, sadly, is that the rates of overdose continue to just escalate globally across our country, and HPE is no exception. In fact, our rates of overdose are often higher than the provincial average. So we're not immune, and if anything, it's quite a significant problem. So without further ado, I'll turn it over to your panel to hopefully provide some information that will be of help to you guys.
Thank you, Mary. I would like to quickly introduce Jody, Director of Community Impact, who is going to do a quick land acknowledgement before we jump into the panel.
Thanks, Kate. Yeah, on behalf of United Way, Hastings and Prince Edward, I really would like to thank you all for joining us this evening for this important learning session hosted by Youth2Youth. My name is Jody Cooper, and I'm the Director of Community Impact here at United Way HPE. Recognizing that we're all joining from various parts of this community, Really like to start off this session by sharing our land acknowledgement statement for our catchment area. We acknowledge and honor the fact that our service region is located on the territory of the Huron-Wendat, the Anishinaabe, the Haudenosaunee, and directly adjacent to Gindage, the Tyendinaga territory, which is part of the Mohawk Nation. We're grateful for the opportunity to live and work here. And as a staff team, we're thankful for the generations of people who have taken care of this land and continue to do so. We also recognize the contributions of the Métis, Inuit, and other Indigenous peoples who have and continue to live in these communities. United Way HPE is committed to acknowledging and appreciating the Indigenous people's historic connection to this land and to raise awareness of our Indigenous partners and communities. It's important to atone and rebuild. As staff, we're also committed to learning and to self-reflection. We want to recognize that this land acknowledgement is one small part of our journey. Moving forward, we're dedicated to listening to, learning from, and collaborating with Indigenous communities and partners. We're committed to weaving this learning into our policies and practices on an ongoing basis. Part of our role here at United Way HPE is to help create community capacity by fostering awareness and empathy. Youth are our future leaders, and we feel that it's incredibly important to let the youth lead the change they want to see in our community. That's why we're so thrilled that the Youth2Youth program has spearheaded and is hosting this event. So I'd now like to turn things back over to them and let them continue to lead today's discussion.
Thank you, Jody. So I'd first like to start with introductions. So I'll have each panelist introduce themselves and a little bit of their background. I will call on each one of you so you don't have to guess who's going next. So we'll start with Jeremy.
Hi there, can everybody hear me okay? Perfect. So my name is Jeremy Owens. I'm a public health nurse in the harm reduction program at Hastings Prince Edward Public Health. Part of my roles entail naloxone training and education, decreasing the stigma associated with drug use, and decreasing stigma as well. We have our needle exchange program that I am a part of at the health unit, as well as the naloxone distribution as well. As Mary spoke to, we are hosting the training down in Picton tomorrow from 9 to 12 for anybody that is interested. And I also do some statistical analysis as well as advocacy for our community partners.
Great, thank you, Jeremy. Missy, I will let you go next.
Hi, so I'm Missy Bodden. I am a Kairos youth substance use and addictions counselor here in Bancroft. I cover the North Hastings area. This is not a new position to youth diversion, but a new position in Bancroft, and I am beyond thrilled that this position has come to Bancroft and that it's me. I will primarily be working in the schools. North Hastings High School is my primary location that I'll be working out of, but then I'll also cover all the other schools and the elementary schools, doing a lot of psychoeducational workshops and then prevention and education. So it's been about 3 or 4 months. I've been doing a lot of networking here in Bancroft. I'm from Bancroft. I went to school in Bancroft. This town is very important to me, and I am just happy to be doing now what I'm doing. It's very needed. And so far, the community, the public, all the other agencies have been so wonderful in accepting, what I'm doing and what I'm here to do for the youth. They all think it's amazing. A lot of community members see the increase of drug overdoses here and the deaths, and they're concerned about our youth, and I'm hoping that I can make an impact in one way or another, getting to our youth. So I'm very happy to be a part of this. New in the position, doing lots of training, attending my background is addictions and mental health. I studied at Algonquin College. I studied at Conestoga College, and And this is where I'm at and where I want to be. So I'm very happy to be a part of this. It's wonderful. So thank you.
Thank you, Missy. Derek?
Hi, my name is Derek Van Alstein. I'm the regional harm reduction worker for formerly HARS, HIV/AIDS Renal Services. We actually changed our name about 3 months ago to Trellis HIV and Community Care. I drive a mobile unit. It's a refurbished ambulance. I have a big catchment area. I go all the way from like Bancroft to Sherbrooke Lake, all the way to Prescott. So I service all those surrounding areas. I do education, prevention, naloxone training. I give out safe use supplies, people don't use substances. I've been in the field for 4 years now. I got over 20 years of lived experience. So I just educate people and just tell my story, and just that's what I do.
Awesome. Thank you, Derek.
Thank you.
Jason?
Sorry, did you say Jason? Okay, of course, screwed that up. Thanks, Kayla. Hello, everyone. I'm Jason Bruder. I work at Addictions and Mental Health Services in Belleville. A little bit of history. I'm an addictions counselor, worked with the agency for the past 8 years. Started off in residential treatment, moved into addiction supportive housing, working with individuals to secure safe, affordable, and attainable housing, then moved into addictions counseling. Currently, I am the hospital liaison addiction counselor in Belleville. So what does that mean? Basically means I go into hospitals and meet with individuals who are there because of substance use reasons, whether it be health, psychological, or both, and try and get people set up with services before they leave hospital. Generally because there's a better outcome when you have a face to the name prior to you leaving the hospital. And yeah, so again, just trying to reduce hospital admissions and do some good work for the community. So that's it. Thank you very much for inviting me.
Thanks, Jason. Amanda?
Hi, I'm Amanda. I'm a nurse practitioner. I work with the nurse practitioner-led clinic in partnership with Addictions and Mental Health Services. I work with an addictions counselor, Sharon Benton, out of Addictions Mental Health Services in the Mobile Community Withdrawal Management Program. And so our program is now a little over a year. So it's a toddler now. It was in its infancy. We've been working really hard to kind of build that program over the last year. And in the community, we support patients and clients who are wanting to make changes around substance use. So cover a large catchment, the county, Trenton, Belleville, Central Hastings, and North Hastings. Would go up to North Hastings as well. Majority of the clients that we've seen have wanted support around alcohol use and opioid use, but we also support clients with polysubstance use, stimulant use, etc. My background is I'm a primary care nurse practitioner and had done some specializing in addictions medicine. It's something I'm very passionate about, and when this role came to be, I applied and left my primary care practice to come and step into this work. Really happy to be here. Thanks.
Awesome. Thank you, Amanda. Craig?
Thank you very much for having me. Hello, my name is Craig Simmons. I'm a youth probation officer, is my primary role in Belleville. So I supervise young people who have been convicted of an offense which occurred between the age of 12 and 17 and have been sentenced to a community-based sentence order, like a probation order. I also provide case management services, and our office covers Belleville, Trenton, up to Bancroft, and as far over the other way is Napanee, I believe. And then my other role is I teach at the college part-time. I do have some background in addictions work, but not for quite some time, I guess. But thank you for having me.
Thanks for being here. Thanks, Greg. And finally, we have Bill.
Hi, I'm Bill Guthrie. I have lived experience. I was asked to come on this panel. It's truly my honor. I know about addiction. I work in the community just as a volunteer. I know most of the homeless people in Belleville. My recovery, I have over 30 years of recovery, and mine has come through Narcotics Anonymous. But there's so many other ways to do it. And so yeah, that's my lived experience, I guess, why I was asked to be on this panel. And thank you very much for having me.
Thank you for being here, Bill. So that introduces all of our panelists. So I will invite Amanda to ask the first question.
Hi, my name is Amanda. I'm a Youth2Youth ambassador and a recent graduate of the social service worker program. I'm going to start things off with a split question. So International Overdose Awareness Day is a day that is dedicated to raising awareness and reducing stigma. In your opinion, why is that important? Spare me to answer that question first, please.
I don't know if Jeremy's name came through on that, but Jeremy, we asked you first.
Sorry.
No, that's
Oh,
okay.
sorry. No, I didn't hear
that's
that. Sorry.
okay.
So yeah, I think raising awareness about overdose is a huge and reducing the stigma is a huge concern right now. Specifically to the fact that there's a lot of people who have lost their lives to overdoses. Many people in our community actually have personal experience, whether it's a loved one or a friend, or even a colleague that has lost somebody to overdose. And to speak to that as well, it's not just about people who use illicit drugs. It's also about making the community aware of what's going on out there with opioids as well.
Thank you. And now I'll ask Derek to answer the question.
Right. I think it's great to give awareness. I've got tattoos on me from friends and family I've lost overdose. We lose people down in the Kingston area. We lost 2 people about 2 weeks ago. And I'm also work at a safe injection site down in Kingston where people can use drug safety. We got paramedics on staff and nurses as well. And I'm also on a committee for decriminalization. We're trying to do safe supply. Instead of the bootleg fentanyl that's killing people, we're trying to give fentanyl patches out that are regulated to yeah, just regulate the drug use more or less, right? Just so yeah, I think International Women's Day is a day for our people, a day to celebrate them, and I think it's a great and to wear awareness. Just like Jeremy said, not only our people, but just about the drug use in general. Thank you.
Thank you, Derek. And now I'll ask Jason to answer the question, please.
I think I would just agree with Jeremy and Derek. It's important to recognize that this is a crisis in our society right now. And the more you talk about it, the more people can come out of the shadows and work through that stigma. The second part of the question was, sorry, Amanda, was what's one of the important things to remember about it?
So my question was in your opinion, why is it important? And then I have a second part if you wanted to answer it. The second part was what is one common misconception that people have?
I think in recognition of a day like the 31st is that, I mean, overdose can happen to anybody, right? Especially with the supply of drugs like Derek identified. All it can take is one time, right? Especially with youth. You know, I was young too. I tried things. I wanted to experiment. But I think nowadays it's so dangerous that important thing to remember is that there is no such thing as a safe drug supply on the street.
Thank you. And I'll just repeat that second part. It was, what is one common misconception that people may have? And I'll ask Bill to answer that question now, please.
I believe the misconception is most the public thinks that most overdoses are done by the person that's using versus I don't believe too many overdoses are anything but accidental. So what I do is I realize in my experience that, like was already repeated, the drugs that are on the streets today are so deadly, and it only takes a very small amount, and it becomes tragic. So I believe it's very important to educate the public with the overdose awareness, because some just aren't aware. And I believe it's sort of a responsibility. I take some of that responsibility myself to educate people so that they are more aware of this disease, which it is a disease. Thanks.
Thank you, Bill. Amanda, if you want to go next.
So I would echo and agree with what everyone has said, and just add that it is so important that we have these conversations, because stigma really further isolates and separates folks that are using substances. It becomes an us versus them, and discriminatory. And then what happens is it really leads to poor health outcomes, because people feel they can't access care. Or if they access care, it's only one specific type of care that's acceptable. So it's looking at some of the stuff that we'll be talking about tonight about harm reduction, treatment options, right? That everything is discussed and on the table, and that we're really meeting people where they are at with what their goals are in order to support them. And I think a common misconception, as Jason, and everyone has said, is that this can happen to anyone. It affects all people, all walks of life. It doesn't matter, kind of age, race, culture, socioeconomic status, that this does happen to all individuals. And as Jeremy stated, we're really all very connected, and in small communities quite connected. And so probably have been touched by this in some way or another.
Thank you, Amanda. If Missy, you want to go ahead there?
Sure. So International Overdose Awareness Day to me is very important. I think a lot of times people don't realize that the person that dies from an overdose is someone else's child, mother, father, niece, nephew, but more importantly, a human. And this human has talents, gifts, personalities that they could have shared with other people and that valued them. And people don't recognize that an overdose death is preventable. There's something we can do, healthcare supports. There's things we can do. According to WHO, World Health Organization, drug addiction is the most significant stigmatized social problem on the planet. And unfortunately, it's a barrier to getting care, support, and treatment. And I think we need to try our hardest, which is, I've seen that progress of eliminating that stigma. Here, specifically in Bancroft, in my community, there has been numerous overdose deaths. It's a small community, so my friends and family have been affected by that. And I think it's important to raise awareness. And another thing that I don't think a lot of people are aware of is that Good Drug Overdose Act. And I've seen it with my very own eyes. Actually, I saw this 2 weeks ago. I was called to a spot where an overdose was happening, and I saw the person doing the drugs run. They did not want to be part of this. They didn't want to get in trouble. I think bringing awareness to that act might help save a life. And I grabbed my naloxone kit. I found out, called 911, did what I have to do. And just that alone, I think people were surprised. You know, we have a high population of homeless and people who use substances on our streets. And I think if people were a little bit more educated on, you know, those acts and what to do in those situations, we could prevent a lot of these overdoses. And, you know, that person who ran away that, you know, maybe didn't know what to do and panicked and was under the influence. If no one else was there, this person may have died. So I think bringing awareness to the overdose, to the Good Samaritan Act, and just overall education in this is very important. And I'm very happy that this is being brought more to light. That's it.
Thank you for sharing that. Craig, if you want to go ahead.
I did have some points written down, but as you can expect, a lot of people already covered them. Obviously, I would echo a lot of actually everything that's been said so far. But another thing that I think is important about these discussions in general, or these days, or these acknowledgements, is it just brings it out of, for lack of a better term, like out of the darkness, kind of out into the open. We need to have these conversations, and we don't even need to know why we're having the conversations yet, because things sort of just develop sometimes unexpectedly. Like talking about drug use and overdose and things like that has an impact on you know, sometimes bringing things like this out of the legal sphere, for example, and into the health and the psychological, where it should likely lie. And then, yeah, just bringing to the attention of people what naloxone kits are and harm reduction, and yeah, essentially bringing it out of the dark.
Thank you.
Thanks, everyone. I'm going to invite Jess for the next one.
Hi, everyone. My name is Jessica Coolin. I am the Executive Director of the Queen West Youth Center, and would like to thank Caitlin and the Youth2Youth group for inviting me to be part of the panelists. So my question is for Missy and Jason. So we know that the abuse of drugs and alcohol can lead to an addiction, but how do we know the difference between an addiction and drug or alcohol use? And can you tell us what signs we need to look for? So Missy, if you can go first, please, that'd be great.
Sure. I would say that there is a difference in it. I know a lot of, you know, addiction counselors, and in the field, I kind of look at it as a spectrum from one side to the other. You go from your use and experimentation all the way to addiction. So for me, I kind of place that person on that scale or that stage. There are different stages from when they're using, like, to experiment, they're sampling, maybe it's voluntary, prescribed, could be looked at a one-time occurrence. You can go, and then you go to like your regular use. Some people try to engage without developing that addiction, but they could have some higher risk behavior, maybe driving under the influence, doing a little bit more risky behavior. The risk for that dependence does increase. It can turn into a regular occurrence or part of a routine. A lot of people think maybe it's easy to quit at this point, and they kind of keep going and go into that higher risk use. So they continue to use it despite any consequences, whether that's socially or legally. And it kind of takes over a lot of aspects. It takes precedent. There's symptoms, if you were to withdraw at this point, like shakes, sweats, tremors. And it's very hard to stop at this point. Your signs of addiction, there's different forms of signs. like your psychological, you're doing it maybe a way to forget your problems, or you try to relax it, but you've developed that tolerance. And so the withdrawal symptoms are there. There might be mood swings, depression, your physical changes, sleeping habits. There are things that you can look, but sometimes they're not right in front of your face. So there's like one kind of end to the other, but regardless of the stage, I believe that there's always treatment. There's always something you can do. So there is a little bit of a difference, and I find every stage there's always things you can look for or ask about, or whether it's with yourself, you know, the things you can look for as well. I don't know if that answers everything.
No, that's great. Thank you so much, Missy. Jason, can you please now answer?
Yeah, I would agree with Missy. The addiction continuum, right, can take its way up. A compulsion, a need, a desire for the substance. I think sometimes people get, you know, a little confused with the word addiction, right? I mean, for example, someone who uses heroin daily is going to have a different kind of response to being without a substance than somebody who uses cocaine twice a week, as an example. So for me, sometimes even the word addiction can cause people confusion. I see a lot of people in my daily work who say, yeah, but I'm not an addict, so, you know, everything must be okay. So I think that in itself can be a confusing word. As far as signs and symptoms, psychosocial, right? The brain and the behavior, your social life, your school life. Maybe you're isolating more. Maybe you find yourself in conflict with your parents more. Maybe you're getting suspended from school, in trouble, and have to go see Craig, maybe. There's lots of things that can go into that. Obviously, I think if we're talking about youth, you know, the underdeveloped brain, you put substances in that, and the lack of maturity, lots of things can come from that. But for me, again, much like Missy, kind of see from the beginning to the end, unfortunately, and there's everywhere in between. So yeah, there's, for as many different people, there could be many different signs and symptoms, right? I could technically be, you know, addicted to something and show up to work every day, or I could be addicted to somebody and not show up to work every day. So I think working, somebody mentioned it, I think it was Amanda, meeting the person where they're at, focusing on that person, their wants, their needs, and to work through those signs and symptoms to help them through whatever stage they're in.
Perfect. Thank you so much, Jason. And Bill, I'm sorry, I forgot to mention that this question is for you as well. Would you like me to repeat it quickly?
Yes, please.
Absolutely. So we know that the abuse of drugs and alcohol can lead to an addiction, but how do we know the difference between an addiction and drug or alcohol use? And what signs can we look for?
In my experience, differentiate between someone that's truly addicted and someone that's just using as a recreational user. For me, if I look at it, if you can have a couple of drinks and stop, and you can use drugs once in a while, then you probably don't have an addiction issue. But if you need it every day, then it's 100% an addiction. I know in Narcotics Anonymous, we don't deal with substances. We don't want to know what addicts or people that come to our rooms, we don't want to know what they use. It doesn't matter. We only focus on the disease of addiction. And so, you know, it varies. When someone walks into NA, my first question to them, if they don't know whether they belong here or not, I ask them if their life is unmanageable. And if their life is unmanageable, maybe we can help. It's realistically, it's just one addict supporting another, and, you know, listening and caring. We also share in our rooms that we will love you until you learn to love yourself. And that's, I believe, is a very important part of someone with addiction versus when you're just, I joke sometimes that the people like they can use and walk away, they're not like Bill, but that's okay. So that'd be my difference. And what's already been spoke, isolation, you know, talking back to your teachers. Actually today wouldn't be just talking back. They're probably a little bit more violent than that. In my years of using early on, I started at 10 years old. And by the time I was 14, I was in Jason's office because, not Jason, I'm sorry, Craig's, because that's how my addiction had progressed. And so I know the difference, you know, those that can go out and be sociable, that's not necessarily considered an addict. Thank you.
Thank you so much, Bill. And thank you everyone for your answers. I would like to pass this on to Caitlin.
Thanks, Tess, and thanks, everyone. Our next question is for Amanda and Jeremy. If you need me to repeat it throughout, just let me know. So we understand that naloxone is one tool to help save the life of a person who is overdosing from an opioid. Can you first tell me how to recognize an overdose and then explain naloxone, how to use it, and how to access training on it? I'd also like to learn more about other tools to help someone if naloxone isn't available or isn't appropriate to use. And we will start with Amanda.
I'm thinking, Jeremy, do you want to take it on the first part of this? Because I'm thinking you're doing your training tomorrow and this is your expertise. Not that I don't do this, but and then I can pick up. Does that, what are your thoughts?
Fine, for sure.
Okay.
Yeah, no, that sounds great. So one of the telltale signs of an opioid overdose is essentially not being able to wake somebody up. Their breathing is shallow or basically unresponsive. And they have really blue lips or blue nails as well. As for naloxone is it's a reversal agent, so it works against opioids. Basically what it does is when it enters the body, it binds to the receptor sites in the brain and prevents the opioid from depressing the central nervous system and allows you to start breathing again. So I guess, so that's essentially what it does. It comes in two forms, it's either injectable or via the nasal cavity. We recommend having some CPR training too, but after you administer the naloxone, it is recommended to do CPR too as well. There is a 5-step guide as well as a training program or booklet on our website that anybody can access. Oh, perfect. Thank you, Amanda. That's exactly what I was talking about. I don't have one handy, but yes, that's it. And we also have one from the health unit that we've made up as well. That 5-step guide is also in our training booklet. How to access training. I know that Derek said that he does offer training outside of the HARS van as well. And if you contact the health unit and ask for myself or my colleague Christy Reeve, as well as some others on our team, they can provide naloxone training on an individual basis, or we do also do group events as well. I'm going to touch on to get naloxone too. So Derek offers some out of the HARS van as well. Most of the local pharmacies in Hastings, Prince Edward have naloxone available. I believe you can go in and get a couple kits there. Every single one of our health units in Belleville, in Trenton, in Bancroft, and in Picton all have naloxone available to the general public. And it's free of charge, I should say as well. We also have partnered agencies. The CHC is one, along with a couple others in the community. We do have a list and they will be updated and posted on our website as well. So the last part of the question, speaking to other tools available if someone or if nobody has naloxone. Unfortunately, to my knowledge, naloxone is the only medication that can rapidly reverse an opioid overdose at this current point in time. So naloxone is the best tool to have on hand to reverse an opioid overdose. I mean, there is still always calling 911 and hoping that the paramedics get there in time, but the paramedics are also going to be using naloxone to reverse this overdose, specifically related to opioids. All right, I think that's I think that's my spiel. Go ahead, Amanda.
Thanks, Jeremy. I'll show you one of the kits that you can get. And as Jeremy already said, so this is a nasal kit. And you can see you would put your thumb and your finger and depress up in the nasal. One of the questions I get asked often is, but if the person's not breathing, how does this work, right? If you're putting it up their nasal cavity. And so the medication is actually absorbed through the sinuses and the lining. So it's not a worry that they're not breathing through their nose at that time, because I've had people say, I haven't wanted to use it because what would be the point if they're not breathing it in? So it's not through our respiratory system that that medication is absorbed. Jeremy already went through, those signs: pinpoint pupils, bluing of, bluish nails around the mouth, signs of loss of consciousness or inability to keep awake, and can be gurgling, choking, breathing, or discomfort that way, shown as well. It is a temporary reversal agent. So I think that's really important. One is that within 3 to 5 minutes without oxygen, we can have brain damage. So one, as quickly as possible, we're making sure we are utilizing naloxone, and remembering that 911 really needs to be called. As Missy has already said, the Good Samaritan Act, we can have a small amount of drug possession on us at that time, and not have legal implications from that. But calling and ideally staying with the person, making sure that if they are not breathing, CPR, as Jeremy has said. So training in CPR can be very helpful. In the kit, there's a barrier to apply for breathing if you are doing ventilation. And the important thing is stay with them. If they are breathing, putting them into a recovery position on their side. In that kit, it shows you what a recovery position is, but essentially on their side, arm is up, hand is here, and you're bringing them over with their one knee up so that they can't come over. But if they were to be sick or vomit, they're not laying on their back at that time. The only other thing I think that's really important that I want to say to the second part of the question is, so we know opioid reversal from Narcan or naloxone. However, when we think about things like, we don't always know the substance that somebody has used. People can be purchasing stimulants, for instance, but because of the toxic supply, we're often seeing contamination. So even if a person has used something and you're unsure, but you are seeing some of those signs, they do have loss of consciousness. If you administer the naloxone and it's a stimulant, you're not going to harm someone. So we're never going to hurt someone by using it, but it is not going to reverse an alcohol overdose, a stimulant overdose. It is only going to reverse the opioid. In that. So when in doubt, use it. You aren't going to hurt someone that way if it is a stimulant. Like I said, it could be that there is actually an opioid on board that the person isn't even aware that was in there. As Bill really had said before too, this is often accidental. This is not an intentional thing, right? And so people may be purchasing thinking this is crystal meth, this is crack, this is, but there is contamination possible. When thinking about that for either stimulant overdose or overamping or alcohol overdose, really we're wanting to call 911. You're wanting to, like I said, when in doubt, administer the naloxone, put them in a recovery position and stay with the person. Make sure it's a calm environment. They don't have anything around them, any hazards if there were seizures or anything like that that were to happen. I think that's my main, my main points.
Amazing. Thank you so much, Amanda and Jeremy. It's really, really good to know. I'm going to pass it to Ali for the next question.
Awesome. Thank you so much. Hi, folks. My name is Ali Dafo. I am the program coordinator at the Queen West Youth Center. And I'm going to be posing this question to Amanda and Derek. We are hearing more and more about harm reduction strategies. What is harm reduction and what is it not? Why is it important for this community?
We can start with Derek.
Hi. So harm reduction is just meeting people where they're at. No judgment, no stigma. We use harm reduction in everyday lives, like wearing a hard hat, seatbelt, looking both ways across the road, wearing a mask for COVID, but it's all harm reduction. Safe use applies. You just educate. Like if people are going to use substances, that's their business. Just use safely. We do not recommend people use alone, but if you do use alone, there's a 24-hour hotline through Norris. You can contact. They'll stay in line with you for 10, 15 minutes. If you don't respond, they'll send the paramedics to your address. Like we say, you can't log swim yourself, so do the buddy system. And we don't recommend people like stagger, right? Like if I'm going to wait 10, 15 minutes, the next people don't just use right after, because if you guys both go down, then no one's there to save you, right? So yeah, that's just that's what harm reduction means to me anyway, right? And with the safe injection sites as well, that's a harm reduction base. Because with overdoses, it costs money to transport people to the hospital, so forth. A death costs the government probably $8,000 to $10,000 every time someone passes away from overdose. So that helps save money, right? So yeah.
Thank you. Amanda?
So Derek kind of nailed it all, which is perfect. Yeah, harm reduction is really aiming to reduce harms, right, to an individual and a community. And as Derek said, we do this in everyday life, right? So sometimes I think this is where stigma comes in play for folks using substances, is that sometimes in the community or others, they can have thoughts about things like safe consumption sites, and harm reduction approaches. However, as Derek has said, they're clipping on that seatbelt every day. They're wearing that hard hat. There are rules in place around tobacco. We use nicotine replacement patches. That's harm reduction. We have buildings set up so that we smoke outside and reduce exposure to community members. So this is something that we are doing and living every day to support our community and individuals. The really important thing is that harm reduction is at every stage. I think of it like a foundation of all parts of care. So not just parts of treatment, but in every should be in every point of access for someone. And really it is the goal of meeting somebody where they are at. It's knowing that and accepting that people are going to use substances in life, and that it's a continuum, it's multifaceted, right? As Derek said, we can think about how to reduce harm based on the substance that's being used, the way that it's being used, the community as a whole, and drug policy and prohibition as well. It really should not be judgmental and should not be coercive and should not be abstinence-based. So that may be a person's goal and that may be part of harm reduction, but that may not be. And so it should never be a coercive approach or us telling people where or what they should be doing, but providing all the options that they would like you to provide them. So asking, right? Asking for permission. Is it okay if I share a little bit about this? Would you like to know more about this? Being trauma informed, right? And is really important when we're providing care.
Awesome. Thank you so much. I will pass this on to Amanda.
Thank you. This next question is for Craig, Derek, and Missy. If youth are concerned about their drug or alcohol use or struggling with addiction, what are some of the implications of continuing to use? Why is it important to get help early? And how common is youth addiction? And I will start with Craig, please.
Yeah, thank you. I think the first part, in terms of the implications, that's pretty broad. I mean, social implications, family relationships, health implications, somewhat unique for youth as well, because as we know, brain development continues throughout our teenage and into our early 20s. Financial, obviously, job loss is the case, and for some people, but also just, you know, substances cost money, right? And then, you know, legal, which I work in the sphere of legal. So I do work with young people who are, you know, sometimes working with me because of addiction. I will say that anecdotally, I think it's a lot more rare than it used to be. I don't have a lot of young people with like possession of drugs, or even trafficking is kind of rare for me. So I don't think it's as common as it used to be, which is a good thing. But if somebody is addicted to substances, I think that there's more of a likelihood of just coming across police. You know, especially if you don't have money to afford the substances. So, you know, I've worked with young people who break into cars to get money or whatever's in the car, and obviously that sort of stuff can lead you on a path to me. The second part about catching it early, I think it's just like trying to dam up a stream as opposed to trying to dam up like a rushing river. A lot of the skills, strategies, practices that are helpful, that the addictions counselors here would know about, they don't work if you just throw them at somebody in a certain state. It's kind of like trying to introduce a complicated breathing technique to somebody who's in the throes of an anxiety attack. Like, you can't start then. You need to lead up to that sort of stuff. You need to practice that stuff. And then why starting early? I mean, for the same reason, I think it's a good idea to disrupt any link between strong emotions and substance use early, because that link gets reinforced, and it's the substances that used to work may not work to deal with those strong emotions, and then it can potentially escalate to other ones that are more harmful. That was a really long answer, but thanks.
Thank you. Derek, if you want to go ahead.
Hi. So yeah, we're seeing, I work at a shelter as well down in the Kingston area, and we're seeing more than 14, 15-year-olds using fentanyl, which is unheard of. Overdose in multiple days. And you got to think, the more you overdose, the lack of the brain oxygen and the cognitive. So yeah, it's and the implications is no money, right? You're a youth, you need money for drugs, you're going to steal, you're going to rob, you're going to do so-and-so to get your money. I know I was youth once, I've done the same thing. And yeah, to catch them when they're young is where people like me come in with lived experience, right? We tell our stories, we educate these kids and tell them, you know, this is not the life to be living. And, you know, kids are these days, they don't really listen, but the whole point is trying to educate them, just let them know, right? And when you're young, it's all about trauma as well, right? People use for different things. Who knows someone's story? And that's when you just got to get to the grassroots and trying to figure the problem out and talk to these youths, right? So that's all I got. Thanks.
Thanks, Derek. Missy, if you want to go ahead.
Sure. Well, I think fortunately, no matter what stage of addiction that someone's in, that there is help. Help is available. And addiction is something that will get worse if untreated. And of course, the earlier treated, the better. The chance of being able to quit or stop increases the earlier you do it. So as a youth, alcohol and drugs can affect, you know, their general overall health, but their physical growth, emotional, their social development, how they make decisions, how they think, how they react. And I think the more we understand about the brain itself, and the more education around that, and what these drugs are, and that they contain these chemicals that disrupt the way the nerve cells normally send and receive and process information. So drug is now interfering at a time in a youth's life where the major brain development is occurring. So like some have said, areas that are responsible for maturity, self-control, decision-making, it's very important at this time for them to understand. And I found out throughout time explaining this to somebody that, you know, had a stigma against people using drugs. When you explain what the drugs do to a brain, they kind of get a little more sense of empathy and towards that person. That, you know, I come across a lot of people that, you know, that stigma is real. Oh, they brought that on themselves. That was their choice. I'm constantly having that. And when you educate and explain something, they start to come around a little bit more, and explaining to youth what those drugs are doing to their brain and to their body, because sometimes they're getting their information from incorrect sources. I have youth that say, oh, my dad told me to stop vaping and start smoking again because it's healthier. No, you know, so I think if the more education, the more knowledge, and the earlier the better, increases their chances. But also that harm reduction piece, the trauma informed piece, it's all a working continuum. Yeah, that's all I got.
Thank you so much. Kate?
Thanks, everyone. I don't want to go over too much of your time that I promised, but I do think that it's really important that after having conversations like this one tonight, that we do talk about the available resources that we have in the community. So if you have to leave, I understand, but if you can stay on to just chat about the resources for youth and or parents that we have locally, I would really appreciate it. So I will start with Jeremy.
So this is kind of a difficult question for myself to answer. I'll do my best. As for Hastings Prince Edward Public Health, I do offer education around naloxone, stigma, that kind of framework to anybody that wants to have it. There was the Great Youth2Youth Summit this year in Sterling, where I did training for the youth there, 15 and up. So that is something that we can offer. I also believe that in the school systems, there are addictions and mental health counselors. I'm sure a couple other people on this panel could speak more to that than myself. But I do believe that it is a good resource, and they can be accessed through our school nurses as well. Hastings Prince Edward Public Health has a school nurses program, and there is a nurse in almost every single school in our region, and they would be able to refer to that addictions counselor as well. That's it. Thanks.
All right, thanks, Jeremy. Jason?
Yeah, I think you're right, Jeremy. There is addiction counselors in the schools now, which I think is a great program. I currently work with a couple of youth in our youth substance use program, which I'll kind of talk about in a second, that report great things working with some of the addictions counselors in our local schools. So at Addictions and Mental Health Services, obviously addictions and mental health services, anyone 16 years of age and older can access our services. We do have a specific youth substance use program in collaboration with Youth2Youth, which is right across the street, basically. So you can get the services of an addictions counselor, mental health, I think psychotherapist at Youth2Youth to kind of work on both those issues. You can see a regular addictions counselor as well. You can come see me or any of our other wonderful ones. There's Youth2Youth, there's Canadian Mental Health, AA, NA, as has been discussed. Smart Recovery, there's not an in-person one here in Belleville, but you can go online to smartrecovery.org. Again, as Amanda spoke, at our agency, there's the Community Mobile Withdrawal. So yeah, I think there's resources. Is there enough resources for the need? No, but that's more of a government funding issue that is above our pay grade. At least I think no one here is a minister, as far as I know. But yeah, I think normalizing it is, again, right? Part of the problem I see with young people coming into my office is just that stigma, right? What are my friends going to say? What if my teachers find out? They're going to think I'm this or they're going to think I'm that. Again, the most important job that I have is to listen and not judge, and just talk to people.
Thank you, Jason. I will pass it to Amanda to speak on her role.
So we're going to get thin with resources with all of us as we go along, probably. As kind of Jason and Jeremy have already kind of alluded to a number of resources locally. And as Jason said, in our program, we do support clients that are 16 years and older. We work with the client themselves, family. We would often kind of look to another addictions counselor within the organization. As Jason has mentioned, there's a number of wonderful addictions counselors. And so the addictions counselor and myself in our program work with a client. And then oftentimes family, spouses, friends, partners, all different, that may want supports are often referred to their own addictions counselor. So there's not that conflict of interest. And it's a really safe and open space for people to go and to share and get the support that each individual needs and is tailored to themselves. And then, Youth Hub, that partnership, and then many of the programs and clinics around, I think, are generally kind of focusing on exactly the same age. Children's mental health is available as well by referral. Mm-hmm.
Thank you, Amanda. Bill?
So as I've already heard, NA, AA might also add for family support. There's Al-Anon, there's Narcanon, and there's Narateen. And they're all online right now. So if family members want to know more about the disease and what goes on, those are 3 very viable resources to get more information. That's all I got. Thanks.
Thanks for sharing those, Bill. It was actually a really great suggestion. Craig.
Sure, yeah. So I guess it depends on number of factors. Is this, like if we're talking substance use and addiction awareness programming, for example, for young people, we use services like St. Lawrence Youth Association, their community support team, St. Leonard's in Belleville has a number of programs. Youth Hub was mentioned, addictions and mental health. Of course, there are, for the more significant or severe, I don't know which word to use, but in cases of addiction, there's inpatient programs. Dave Smith comes to mind. CAMH, I've worked with them before, concurrent program. Kairos, which it's come up already. I think that there's also there's difficulty. I've worked with a 14-year-old who was overdosing on a number of substances and was a heavy meth user. It's very difficult to find support for somebody that age in this community. A lot of the cutoffs are 16 and up. The agencies are great. They'll work with you. Like, wow, I got 15 in a couple of months. Like, will that work? And they'll say yes. But I think there still is a bit of a gap there. And then I've also, unfortunately, we lost earlier this year a man named Joe Brown in the Tyndonega territory, and he was a great support for young people with land-based counseling and things like that. So, a very unfortunate loss for our community in Tyndonega, especially. Thanks.
Thanks, Craig. Derek?
Hi. So I wasn't too sure what resources. So I talked to Sean this morning from Youth Diversion, And he said that Kairos is up there in 4 schools, youth tab 16 and older, addictions mental health 16 over in public health. And that's the resources he gave me. That's all I really know. But they mostly all been said, so. Yeah.
That's all right. That's great. Thanks, Derek. Thanks for doing the research. And then I'll get Missy to share it, and maybe specifically to Bancroft. Since you're in that
Yeah,
community.
yeah,
Great.
sure. Well, we do have the addictions and mental health services, 16 plus, that's at the manor here. We have me, youth diversion now. And so I service between 10 and 17, a very easy referral process. I have been in the schools a little bit at the end of last year. I've been around a lot of the drop-ins, and the space where I work out of is actually a naloxone training. It's with North Hastings Children's Services. It's Sarah Phoenix. She does the training there. Kits are available there on site. And of course, it's been said, those kits are available at all the pharmacies here. As far as programming for like families that are, that maybe have youth with addictions or support groups, there really isn't, and I've been trying to, it's a small community and I've been here almost my whole life. There really hasn't been a whole lot. We had AA at one point, but nothing specifically tailored to youth. But I know that that's kind of been in the works here with some agencies and some doctors and nurses. They tried to get the Safe Use Hastings. They tried to get a safe injection site. That is not a go anymore, unfortunately, but our Bancroft Family Health team has tried to take that over. We'll see if that can get off the ground again. But I'm mostly in the schools, all the schools here, and the individual doesn't have to necessarily be using the substances. They can be affected by substances. So whether that's a parent, mom or dad using, and just processing that, and how to go about dealing with that. So, which is nice because sometimes that person isn't using, but I can still be there to support. So right now there's only one of me. I feel like there could be, of course, more counselors, as most areas it's very under-sourced. So hopefully this can be a start to something even more. But the majority of my caseload that I'm seeing now is, I would say 90% are marijuana use, vaping marijuana, and a very low rate of the other drugs. So, and a lot of them are using because of stress, anxiety, sleeping, and that's kind of more what I'm seeing. But it'd be nice to get some more support groups out there. But that's all we've got so far.
Great, thanks for sharing, Missy. Well, that concludes our International Overdose Awareness panel discussion. Thank you all for staying late to share those resources. I know how valuable that is when listening to these panels. I'd just like to thank all of you for taking the time to join tonight and speak on such important topics and sharing your knowledge. I'd also like to thank our ambassadors for creating and being a part of this important initiative, and for Mary Labine for joining us tonight and sharing that partnership with AMHS HPE. Again, International Overdose Awareness Day is Wednesday, August 31st. Belleville is hosting an event at Market Square from 2:30 to 4:30 p.m. And there are different events happening across HPE. Thank you all for watching, and thank you again for joining. Have a great night. Thank you.
Thank you very much.
Thank you.
Take care.
Thanks, Caitlin.
Thank you.